It is negative 5 degrees outside. So let's talk about you call 911 for a cold exposure. Live, laugh, love, the Midwest. My name is Ashlyn. I am a paramedic. I have a series on my page called So You Call 911, Now What? It's basically to give people a peace of mind of what's going to happen when they call an ambulance for any sort of reason. Since it is negative 10 degrees outside, I figured it's a perfect time to talk about cold exposure. This is one of those situations where we can't do a whole lot, but the things we can do matter the most. When we're talking about cold exposure, I'm not talking about you've been sitting outside for a while, it's a little chilly, you don't want to sit outside anymore. I'm talking about frostbite. I'm talking about the people are unresponsive because they got so cold. A lot of times what happens is EMS is getting called for a man down. PD drives by, they see someone in a ditch. Somebody else drives by, sees someone laying on the ground or on a park bench. It's snowing, negative 10 degrees. We go out, we check on them. They're unresponsive. They're barely breathing. They barely have a pulse. They're delayed cap refill. They're cyanotic. They're pale. They're bundled up in like 80 layers of clothing. It's not a good situation. The patient care starts before we even get on scene. If we're getting called to something like a cold exposure, we're going to jack up the heaters in our trucks to make sure that we have a very warm environment. And we're also going to make sure our IV warmers are working. An IV warmer is basically this little pouch. We put IV bags in there and we warm the fluid because we don't want to be putting cold fluid in you. No. Once we get on scene, it's just like most calls. Airway, breathing, circulation. Are they breathing? Do they have a pulse? And what do I need to manage first? However, one of the most important things, get them out of that environment in the back of your truck, remove the clothing, especially if they're wet, because it's conduction. You know what I'm saying? They are never going to get any warmer, no matter how hot you make that ambulance, unless those clothes are removed. Then take them warm packs. You know those things that to pop them? It's my favorite thing to do. You're going to put them in the point, okay? Axillary, behind the neck, in the groin, behind the knees. You're going to put them in those main spots. And then if you can get an IV, if you have to start an IO, slowly infuse warm saline. Yes, we want to rewarm these patients, but we do not want to send them into shock. So you can't rewarm someone, go from 70 degrees to 100 degrees in a matter of 5 minutes because their body, what's happening when they get too cold is they basically go into like hibernation. Everything slows down. Their breathing, their heart rate, they probably have a dysrhythmia of some sort. Their brain just kind of goes to sleep. All of their heart slows down. Their blood is shunted to the core. You do not want to send them into shock by freaking out their body of, oh my God, what just happened? So we gradually rewarm someone. Aside from rewarming, we also have to talk about frostbite because that is going to be very common. Frostbite, there's different stages of it. I'm going to put a whole picture of it right here because I'm going to be honest with you. I don't remember exactly all the stages of it, but you don't want to cause any friction or manhandling to these. It's mainly going to be the fingers, the toesies, the nosies. You don't want, or the ears even. You don't want to manhandle these. The tissue is very friable. You know when someone gets burned and you're like, that doesn't look good. Same thing as frostbite. You don't want to manhandle it because that tissue is so fragile. Literally, slightest touch could fall off. That's a little dramatic, but treat it like it's going to fall off. Do not stick anything wet. Even if it's warm wet, don't stick anything wet on these appendages. Maybe wrap them in gauze, but do not cause friction. Just gently cover them. Delicate little flower, put a little blankie over them. Imagine that. They're probably going to lose that appendage anyway. It's very, very sad. But you don't want to cause them trauma to maybe cause more to be amputated than what needs to be. Watch out for cardiac dysrhythmias. The Osborne waves is something that I thought was the coolest thing when I was in paramedic school. I've never actually heard someone see them before, but different cardiac dysrhythmias such as like maybe VTAC or just any type of like electrolyte imbalance type of rhythm, watch out for those, treat them accordingly. But most importantly, the thing is to manage the airway, the breathing, the circulation, reworm gradually and get them to the hospital where they can have the bear huggers, gradual increase of fluids, and hopefully that mental state does return because the body kind of preserves itself. A good amount of these cases, they do come back okay because the body has like a natural little, just, we're chilling, we're hibernating. It's like a bear in the winter. It's all good. It's all fantastic. But just in case, they're going to do all the studies. They're going to watch them very, very well. They're going to internally monitor that temperature and ultimately deliver the best patient care because that is all we're delivering in 2024 and many years to come. That is all. Stay safe, stay warm, stay off the roads, because if you don't want to get out there because the roads are dangerous, we don't want to get out there because the roads are dangerous. But we will, because you call 911 and you need us. Have a good shift.